So welcome everyone. Today we're going to be doing a presentation on chronic pain and what it's like to live with it. We'll have some brief information on some conditions that we're going to be going over today. And we have some guest speakers that are joining us and sharing their time and their experience with what it's like for them to live with chronic pain. So before we officially get started, we're going to do an access check. Everyone will be doing a verbal image description of themselves, including myself. So I'm Stephanie. I'm one of the co-founders and co-presidents of Invisible Illness Awareness Network. And I'm a white woman with long brown hair, and I'm wearing a black shirt. There are also captions available, so you can find them on the bottom panel by pressing the CC button if that's something that would be helpful for you. And if you have any other accommodation needs, please let us know in the chat. We'd be happy to accommodate them. And some important disclaimers before we get started. None of what we're talking about tonight is medical advice, so please consult your physician if you have any medical concerns for yourself. And please note that each person with a condition is unique, even among people with the same diagnosis. Everything is generally a spectrum of symptoms. And please know we are also not experts on these topics we're talking about tonight, but our guest speakers are experts on their own medical conditions and how their bodies deal with those conditions. So also, we're going to go into what is Invisible Illness Awareness Network? What do we do? We're a 501c3 nonprofit organization, and we raise awareness about different invisible conditions, disabilities, and chronic illnesses. And we also support students at different schools starting their own affiliate organizations of IAN. So we want them to become leaders, educate their peers on invisible illnesses, and foster inclusive environments where people aren't afraid to talk about their conditions and just what kind of goes on behind the scenes. And what is the Invisibly Aware series? You're here today. We currently do one virtual event a month on Zoom. It's a recent change that we've made from 2 meetings to 1. We're trying out a new format. And this event, we have guest speakers who share their lived experiences with whatever conditions or general topic that we're covering for the month. So this month is chronic pain. So we have some guest speakers who deal with chronic pain and have more specific conditions within that realm. So if you don't already, please follow us on social media. Our Instagram is invisible_illness_network. We post pretty often about different conditions and awareness month days and just our general schedule for content. And we also record our guest speaker meetings and put them on YouTube. So you can find us at YouTube at IAA Network. And our website also has more information. You can also sign up for our newsletter and scan our QR code to find our link tree with all of our other links and resources that we like to provide for people. And please ask questions in the chat. We'd be happy to answer them at the end, or if they are fitting in with what our topic is for what the guest speakers are speaking on, we'll do that too. And we'll answer any questions about conditions to the best of our knowledge. But please again, note, we are not experts on these conditions. And with that, I'll pass it off to Morgan.
Hi everyone, my name is Morgan. I am a white woman with long brown hair and I am wearing a navy quarter zip. So I'll be going ahead and giving a little bit of background on some of the conditions we're going to cover today. So first off, I'm just going to describe what chronic pain is in general, since that is our main theme. And so the definition of that is pain that lasts at least 3 months and persists oh my gosh, beyond the expected period. And so there's different impacts that this can have. And of course, that includes physical, mental, and social well-being. And it can be caused by a variety of different conditions. So most notably, illnesses and injuries. It can also be caused by other chronic pain issues, conditions, or it can be idiopathic, meaning that it has no specific cause. There's different symptoms that can result of chronic pain. So obviously there's the pain itself, but it can also lead to stress, insomnia, fatigue, irritability, brain fog, anxiety and depression, decreased activity, and a decreased quality of life. And chronic pain is actually not uncommon in the American population. It does affect about 51.6 million US adults as of 2021. So one of the conditions we'll be hearing about today is complex regional pain syndrome, or CRPS. And so the definition of this is prolonged pain disproportionate to initial trauma. And so this initial trauma is often either just an injury or it can also be from a surgical cause as well. And so it normally impacts the limbs, more commonly the arms, occurring in about 60% of cases, compared to the legs in about 40% of cases. The type of pain can vary, but it tends to be burning, throbbing, stabbing, squeezing, and aching. And there's various symptoms that can be associated with this pain. So that includes numbness, tingling, sensitivity to touch, sensitivity to cold, decreased mobility, changes in skin temperature, color, and texture in the affected limb. And so there are complications that can result of the syndrome, including muscle atrophy and contracture. And so contracture is basically just the stiffening of the muscle, as well as a loss of bone density. And the CRPS can sometimes spread to other regions or areas. And so that is a very important consideration in the treatment and management of the condition. It is a relatively rare condition. Only about 200,000 people in the United States have CRPS. So it's definitely something that is important to bring awareness of, especially as it can be unheard of and not as widely treated. The next group of condition that we will be hearing about today is arthritis. And so this is a group of diseases that cause joint damage. And while there's a very, very big range of this, it is a relatively common disorder. And so the most common is osteoarthritis, and that's what most people tend to think of when they hear arthritis. That's very much due to aging as a common factor there. But there's other types that I would also like to go into and touch base on before we move on. So osteoarthritis, again, is that common condition, and that is caused from the degeneration of the joint cartilage and bone, and that is usually, again, to aging or just normal wear and tear. Gout is another type of arthritis. This is caused from a buildup of uric acid crystals in the joint, and this leads to sudden severe pain and swelling. And normally that swelling and pain happens in the large toe for some reason. Then we have ankylosing spondylitis, which is a chronic inflammatory arthritis condition that mainly affects the spine. This causes stiffness and possible fusion of the vertebrae, which can be quite painful. Then there's rheumatoid arthritis, which is an autoimmune disease where the immune system attacks the joint's lining, and this can cause very painful inflammation and joint damage. We have also psoriatic arthritis, which is an inflammatory arthritis linked to psoriasis, which affects the joints and sometimes also skin and nails. And lastly, we have juvenile arthritis, which is a type of arthritis that develops in children under the age of 16, and again comes with joint pain, swelling, and stiffness. And so, based off of that whole list there, you can tell that there's various different causes of arthritis just because it is such a large group of conditions. So some of the common factors are age, autoimmune conditions, infections, or again, idiopathic, meaning that there's no known cause. And there's different types of pain, but the most common that you see across these conditions are stiffness, tenderness, and swelling. Popular locations for arthritis to be found are, of course, in the joints, but more specifically, the hands, the knees, and the hips, as well as the spine. There's other symptoms that can accompany it as well, such as skin discoloration and feelings of warmth, and that's caused by the inflammation again in the joints. And again, it's relatively common when you look at the group of arthritis as a whole. While some of these subtypes can be a little bit more rare, as a whole, 1 in 3 Americans do have some type of arthritis, with again, osteoarthritis being the most prevalent. Alrighty, so I'm going to go ahead and introduce our guest speakers here. So first we have Jen, who is an award-winning certified patient leader, author, mentor, and podcast host. You can find her at The Graceful Advocate on Instagram, or Jen The Graceful Advocate on Instagram. You can also find her at my_spoonie_sisters on Instagram. We also have Shannon, who you can find at crps.fighter.shannon on Instagram. And I'll go ahead and let the both of you briefly introduce yourselves. So if you wouldn't mind just doing a verbal image description, as well as just a brief description of you are, any background information you might want to share with us.
Okay, I guess I can start. I am a white woman with long brown hair, glasses, and a white button-down shirt. And my name is Jennifer Weaver, and I live with rheumatoid arthritis. But beyond that, I'm also a mom and a grandma, and I love to just be active and have fun and do all the things despite what I live with. And that's a little bit about me.
Yeah, I'm Shannon. I'm a white woman. My brown hair is pulled back. I have a periwinkle blue shirt, glasses, and a black zip up on. So a little bit about me. I live with complex regional pain syndrome, as well as a lot of other things, Ehlers-Danlos syndrome. And one of the biggest things that I will probably touch on once we get more to the conversation is abdominal vascular compression syndromes. I have all of them but one. I like to say it's like the collect them all bingo card that you didn't ever just sign up to go play, and there's no prize for getting a bingo. Um, I'm a college student right now. As I had mentioned before, I'm studying political science. I'm really passionate about healthcare policy and healthcare advocacy, and nursing school is next for me. So that's a little bit about me. In my spare time, I love to be outside. I love to play board games, do crafts, and make the most of life and the gift that we have.
Awesome. Thank you so much for sharing. And I guess our first question will be, can you share your experience of living with your invisible illness, chronic illness, and or disability, and things you might want to touch on, or like when did you start experiencing symptoms, a brief description about how your condition affects your day-to-day life, anything like that. Either of you can start. And thank you so much for taking the time out of your days to share your experiences with us. We really appreciate it, and I know other people watching appreciate it too.
Okay, well, I started noticing symptoms when I was 30 years old, and it started in my left knee. And actually, my doctor thought I had an infection in my knee joint, which I didn't know could ever be a thing, but that's what he thought. And we kind of rolled with that for a while, and the pain continued, and then other joints started to come into play as well. And that's when he started to finally do some blood work to try to get answers. And he was like, you have some form of rheumatism. I'm not sure what it is, but it's time to see a rheumatologist and get this figured out and get this better addressed. And so for me, those were the beginning symptoms and the brief description of how my condition affects me. Okay, well, rheumatoid arthritis, it sucks. It's a condition that nobody wants to join the club of, and it's painful. And like you said before, it attacks multiple joints down the body. And so I've got shoulders that I've had to have surgery on. Next is my foot. There's a lot of injections that come into play. Sometimes they're removing fluid out of joints for us. And so, yeah, it just kind of it sucks. It's pain. But we still try to live the best life we can despite what we're going through.
Yeah, so my experience is actually really interesting hearing yours, Jen, because I think our experiences are so different but so similar. So mine started when I was in high school, which is a really interesting time because there were a lot of social implications of it, in the sense that like my 10th grade friends didn't know how to be a friend to someone who couldn't walk and who couldn't, go ice skating on Friday nights or whatever it may be. So, that's definitely something. And navigating a school that didn't support accommodations, like kind of navigating that side of things, I think really ties into that burnout that comes with it. It's not just pain. Yes, it is pain. It's the symptoms, but it's a lot of times the things that add to that and kind of remind you how big of a role that pain plays in your life and kind of finding ways to like you said, like live your best life kind of alongside. Um, so I was diagnosed with CRPS after an ankle sprain that turned into tendonitis that nothing helped. Eventually CRPS spread. It's kind of had its ups and its downs. But along the way, I feel like CRPS really opened the door to kind of a whole host of other things, finding out that Ehlers-Danlos syndrome, which is a connective tissue disorder where the collagen is faulty in the body. So essentially the glue holding your body together doesn't do a good job holding your body together. So it needs a lot of joint subluxations. For me, I have a lot of GI symptoms as a result of my EDS, and vascular compression syndromes, which have led to multiple surgeries, tube feeds, relying on IV fluids, TPN, IV nutrition, central lines, kind of all of that. And I think the biggest thing is the diagnostic delay for me is like if I didn't have to wait and be told that, oh, you're just an anxious teenager, oh, you know it's just your period or oh whatever it might have been, I often sit and think to myself like would we be dealing with gastroparesis years later, because so I think that's something I go back to. But I love how Jenny said the idea of like you have to kind of find ways to bring you joy in that. And I think a lot of it for me is like setting realistic expectations. Like the best example I can give is like I'm starting a semester. I'm very much still in the thick of auto transplant recovery for nutcracker syndrome, one of the vascular compressions, and like coming back in the semester and like reminding myself like, hey, I am not coming in with the same like cup full that everyone else is. So if I have to like alter my schedule, alter my routine, make more time for rest, like that doesn't make me any less. So I think just setting those realistic expectations and, giving yourself that grace and that kindness that you would give other people, I think we often fail to give it to ourselves and hold ourselves to this unrealistic standard. So I think that's something that I've kind of learned and am continually learning, I guess I should say.
Yeah, thank you so, so much for sharing, both of you all, about your stories and, your conditions and how you got to where you are currently. I think you both speak to a really powerful point about what it's like being chronically ill and having these invisible illnesses, about how you really need to adapt and adjust your, baseline and your lifestyle and what it means to live with these conditions. I think a lot of times people look in and they say, "Oh, I could never live like that," right? And I think you don't realize it until it's you. And you have to adapt. You have to, be graceful with yourself. And again, I think you all shared both a lot of common things in your stories, despite them being so, so different. So I'm curious to hear also about each of your stories and journeys on getting diagnosed. So, for example, how long did it take you to start seeking help after you started seeing your symptoms? And then how many doctors did it take? I know, Shannon, you mentioned that there was a little bit of dismissal there. So maybe what that was like specifically, or if there was maybe any emotions tied to your diagnostic journey. So I don't know if Jen, if you want to start us off there.
Sure. Yeah. So I think, it was probably a couple months before I went in to see my family doctor because I kept thinking, oh, maybe, I'm just overdoing it. I've got three kids in middle school and we're doing volleyball games and football games and all the things. And so I thought, okay, maybe I just need to not do so much. Maybe I need to take a break from working out, just, take care of myself. That wasn't working. And my husband finally was like, okay, this is getting ridiculous. Go to the doctor, get looked at. And it's not that my doctor didn't believe me, he just thought it was something else. And when he put in the note to send me to a rheumatologist, it was right before Thanksgiving. And so that's where things went sideways. And I don't think we're ever prepared for how the offices can misplace or forget to do things, or holidays make things more difficult. And that's what happened for me. And so they supposedly sent all my files to this rheumatologist, and then the rheumatologist kept saying, I don't have everything. What is going on here? Like, why are you even sending me this patient? I don't even have the blood work that shows what I need to see. And it was just this huge back and forth thing. And so by the time they got me scheduled, it was November, and I wasn't going to get seen until March. So here I am watching my hands start. I started getting like where my knuckles got big and they curled and they didn't want to hold things. And I couldn't even cut a steak myself or open a water bottle. And I was in tears thinking, oh my gosh, you can't even get me seen until March. This is ridiculous. Well, I get there on my first appointment and he was ready to send me out the door because they still forgot to send something over. And I just started bawling in his office because I was like, are you kidding me? I've been waiting this long to see you. You're going to send me out and I'm gonna have to wait more months? I can't handle this. And I felt embarrassed crying. And my husband was with me, thank goodness. And he was just like, this has been a really long, rocky road, and it's not our fault that they didn't send over what it is you need to see. And it turned out it was blood work. So he ran 13 blood vials of tests, and that was fine. It was really not that hard. He should have just done it and not argued. I don't know. The whole thing was stupid. And I stayed with this doctor for a year. And so this is where it comes in, and I tell people it's okay to fire your doctor. If they're not listening to you and they're gaslighting you and they're treating you like crap, you don't have to keep going. I went to this guy for a year. He kept giving me medications to treat multiple conditions because he wouldn't give me a diagnosis. A year later, saw my first rheumatologist and I got a diagnosis that day. So I hope I answered your question. That was a lot.
Yeah, no, thank you. That's an incredible story. Wow. I'm glad you finally got that diagnosis, though, but what a journey to get there. And I'm sorry that you had that experience.
It happens to so many people,
Yeah.
and I think that's why we need to talk about it more.
Yeah, I think it's really easy to get lost in the healthcare system with either, the providers not having the means or resources to keep up with it, or the patients not knowing how or what the right move is to be done
Hmm.
next. So, again,
Yeah,
thank you for sharing.
yeah, of
Shannon,
course.
if we could hear from you as well.
Yeah. One thing I just wanted to say is like I think one of the things that I think you kind of indirectly hinted at is that, like there's no guidebook for this, right? Like you're thrown into this world of like, hey, I can barely, pick up a water bottle, do these things, and like I don't know how I'm supposed to handle the fact that this doctor's like, and I think it's one of the things that like is so shocking when you first kind of start developing symptoms is that you realize there's no manual. Like there's no like how to for all of this, So I think it's one of the great things about like things like this that like can kind of pave the way and hopefully prevent, other people from having to go through similar things. But so my CRPS diagnostic journey, I had honestly very clear symptoms once we had hit the point of like the tendonitis not going away. And from then, I was kind of just rushed into, pain programs, which I have a lot of thoughts on. I won't unpack that quite here. But, and eventually tried ketamine and, Sparrow Clinic, and that's really what helped the most. But I think what I want to touch on is more my vascular compression diagnosis journey. At one point, I had become severely malnourished, uh, not tolerating oral intake. I was not yet placed on tube feeds, but I had been before a previous compression surgery, so we knew that's where we were going. Um, I traveled over like 24 hours or something in the car going back and forth to different physicians across different states, like that had, had a good patient experience with this, and literally like I remember I was at NYU down on Long Island, and the internal medicine attending in the team came and said, I don't normally say this to patients, but I think like we need to discharge you, not because like you're better, something's wrong with you, but the GI on service is not going to help you and you need to go somewhere else if you really want to get help. And I'm sorry to say this. And it's something that was like, it sticks with me, like telling me like it was just a really jarring experience. And then went right to Cleveland Clinic, um, where for a rush appointment, literally left the hospital at 9 o'clock at night, drove like 12 hours down to Cleveland. It was absolutely so wild. And I remember I walked into the surgeon's office in Cleveland and he looked at me and he said, I believe you. He said, this is a story that patients like you come in and they have these stories. And he just said, I believe you. Something's wrong, and we need to get you nutrition before anything else. And it's actually really interesting as I eventually transitioned from a nasal feeding tube to a surgical feeding tube when he went in to do the surgery months later. After all these doctors had said, oh, go to your old surgeon, they'll help you, or oh, like you're just anxious, or oh, maybe it's your old issues coming back. He said, I can visibly see malnutrition in your tissues even after months of tube feed. So for all the people that said this was in your head, it's not. And one of the big things is my labs never tanked. So people were like, oh, like I think it might be in your head. And it's one of those things that like that's not always the case. And I think it's something that, especially in the diagnostic journey, is a tip I have for advocating. Something I've learned is you have to really point to that quality of life sometimes. For me, it was like, I can't even like get out of bed. Like this is not in my head. And so for me to be able to have that validation of like, wow, and I actually wrote letters to all of the physicians who misdiagnosed me. Um, and none of them heard back. I heard back from one who he didn't misdiagnose me, but rather he just did the typical test to look for mals, which is an ultrasound. My ultrasound was negative. He's like, it's not mals. I really don't know. Um, and come to find out, you can have a false negative ultrasound. And I wrote him to tell him that. And he wrote me back and said, thank you for educating me. He is now my GI of multiple years and one of the most beloved physicians I've ever had. So I think it goes to show that like that self-advocacy can make a difference, but to focus on the quality of life. So I know that was kind of all over the place, but just some thoughts.
No, you brought up some excellent points there. And it's like, it really matters of the bedside manner of your healthcare provider in handling information that is life-changing to their patients. Like they see many patients every day, but each patient, like this is, if you're diagnosing someone or giving them news about something, it's like that's their life that this news is now changing. And it's the I believe you, like, is so powerful. Like it's night and day difference. It's
Mhm.
either having someone who is not willing to look further or just kind of brushing off your symptoms. So many people with invisible illnesses have mental illness blamed for
Mhm.
whatever they're experiencing. And sure, mental illness can certainly be a component, but it's not everything. It's not the whole picture. And it's definitely not something that can just have all symptoms thrown at all the time. It has a time and a place, but it's not everything. And I'm sorry you had that experience. It's all too common within the healthcare sphere, but I'm glad you did find, I'm glad of that reaction of your current GI doctor now. Like, it, that's something that I think every healthcare provider should strive for. Like, everyone's always learning. No one can possibly know everything under the sun. It's like, it's continuing. That's why people do continuing education. It's you need to keep learning. You need to have an open mind, and having patients come back and be like, hey, this is something you missed, but like I just want to let you know for the future and moving on forward with that. Well, thank you both for sharing your stories with that. That's really, really powerful.
Really
Um,
quick, Stephanie. Sorry, I just want to add
yeah.
something that you said, and it's something that I didn't mention in the introduction, but I think it's important to note. I think we talk about, again, mental illness being blamed a lot for these chronic pain and invisible illness conditions. And I think especially when we're talking about chronic pain, I think it's important to recognize, sorry, my camera froze, I'm not sure why, but recognize that people who are assigned female at birth are more likely to have chronic pain. And I think that leads to why there is likely harder rates of getting diagnoses for people who are female presenting. And I think that's very common, as both of you all shared that you're initially dismissed to some degree about your chronic pain condition. So I think it's something that in our conversation, again, all of us have alluded to, but I think just to kind of call it out and say, hey, there's something much bigger here going on too, that although we'd love to fix it with the system, it's something that's quite broken, that hopefully the more we talk about, hopefully the more we advocate for ourselves, the better that we can make those health outcomes. So yeah, again, sorry you both went through all of that, but
Yeah, and if I can just like add something, I think it's really interesting, and I'm not sure this may not be part of everyone's journey, but I think so often, you go in and things get told, oh, you're just anxious, or gets blamed on mental health, and that leads to medical trauma, right? That leads to like fear of the doctor. It leads to, medical PTSD in some cases. It leads to certain things being extremely triggering, which prevents people from seeking care and makes seeking care 10 times harder. And it's like kind of this, I always kind of say in my head satirically, like when doctors like, oh, you're just anxious. I'm like, no, but you're gonna make me anxious. And I
Mhm.
think it's just really important to like identify that and to like validate those emotions that like some people, your friends would be like, oh, I had to go like get blood drawn. It was really no big deal. And you're like, getting blood drawn is traumatic for me. Like no one can ever get a vein. And I've had like, blah, blah, blah. Like that's okay to have that experience. So I just said I would.
yeah, definitely. And obviously being in chronic pain too would make you more anxious and depressed. Like what came first, the chicken or the egg, right? It's an endless cycle. And I think it's really important to recognize that. And yes, definitely to what Sarah said in the chat as well. It's really, really important to understand all of these populations that are so much more likely to be diminished. So yeah, that's what we hope to use this platform for, is to bring light and attention to these issues, to these struggles, and bring awareness to them. So thank you.
Yeah. And also encourage people to advocate for themselves. Like you said, it's so important to do that. So another question for you guys, how has your day-to-day life changed since your symptoms started? How has your life changed since you got a diagnosis? Some things you might want to talk about are like, what symptoms do you have? What challenges do you face in daily life, physically, emotionally, socially? I know Shannon, you kind of touched on a few of those already. And has your condition taught you anything about yourself or influenced your view or identity in any way, good or bad?
Wow. There's so much we can say
I
here.
know there's so we could be on here forever, but um, talk about what speaks most to you out of those things.
I think for me, it's already bad enough having joints that are constantly swelling and hurting and everything. But there's, like we talked about earlier, there's no handbook. Nobody prepares you. And I found out I needed to start doing infusions. And I was like, you want to do what? You want me to sit in this room with all these old people and you want to do what? And that's exactly what it was. And I walked in there and I had these little old ladies that reach over and they put their hand out and they're like, oh dear, you're too young to have this. And I'm like, oh my gosh, like this is not an old person's disease. And so it was very frustrating. Nothing prepares you for that. And there's side effects. There's huge side effects that come with it. And sometimes for some people, you don't notice anything. Maybe you have a little bit of a scratchy throat or you're a little bit tired. A lot of times they give you Benadryl with your infusion medications. For me, the first few infusions that they tried me on, they just didn't work. And so I kept taking methotrexate and they kept trying all these other infusions. Finally, they landed me on a TNF inhibitor. And what we ended up finding out after a few months is I am extremely allergic to TNF inhibitors, and it actually activated a new illness. And so I ended up at my rheumatologist's office saying, okay, I just went to urgent care. They diagnosed me with a skin infection that they think I caught at the gym somehow. And she looked at my hands and my feet and my legs, and she said, no, that's not what it is. And she left the room and comes back with three other rheumatologists. And when that happens, you're like, okay, this is bad. What are you about to tell me? what is going on here? And they look, they whisper and they confirm and they leave the room and she says, okay, you're allergic to TNF inhibitors. And this like 1% of people, this causes what's called pustular psoriasis. And I'm going to tell all of you right now, if you're easily grossed out, please don't look it up. It's as bad as it sounds. You get pus-filled sores that bleed and ooze and peel like an onion. And so that's what I had from head to toe. And that happened in 2017. And they were like, you're going to live with this for the rest of your life. So here you go. Sorry. Now we have to find a medication that can treat your arthritis and your psoriasis. It, it's embarrassing. You feel like you want to stay home and hide because people are questioning what's going on, or they're reaching over, oh, you poor dear, your hands look like they hurt so bad. Yeah, they freaking do. Can we not talk about this right now? Like, I'm trying to do some work here. Go away. Nothing prepares us for any of this. But the best thing that we can do is educate people and keep standing up for ourselves. And yeah, that's really all I can say.
Were you gonna say something, Morgan? I didn't want to cut you off. Oh, okay. You look like you're about to unmute for a second. Yeah, and I think that moment that you described where like everyone came in the room and you're like, oh, this isn't good. And that's one of the things that's like that's grief, like that's like takes processing, and I think for me that's a lot of the journey is just like I think something that I've learned is that like sometimes things happen and you may not process them immediately and like healing takes time. And like, I think especially like in terms of growing up, kind of navigating new diagnoses, like being placed on tube feeds, like people don't get it. And like in our culture, there's such like if you say, oh, like I have a medical condition that like makes it hard for me to eat and I require a feeding tube to nourish me, people will say and will praise malnutrition. People will praise and say, I once had someone say, I wish I was you. And I was like, really? Really? Like, okay. And it's like nothing prepares you for those kind of conversations too, because it's like I will trade you for 30 seconds and I'm quite sure you'd want to do an Uno reverse right back. And it's really hard because I think it adds to that like dialogue of like your sickness is a good thing. And like I'm not saying it's inherently bad, like good can truly come out of it, but I think it almost like puts it in this pretty frame that's like, oh, but like you have a figure I would like. And it's like, yeah, but like this isn't healthy for me. And this is like damaging my body. And like, I think it just, and a lot of it, I think, comes from these kind of ideals that are set for us that people kind of praise. And that's something that I have really had to navigate is like, hey, like A, not your place. And like, I think kind of going that is like people's judgment. Like I still wear a mask on my college campus because college kids are not the most germ-wise folks around. And so for me with my immune issues, like I can't get sick, so like I will wear a mask, but judgment received not necessarily from my college campus, but like from people in my life about like, quarantine before my transplant. I was like, I can't get sick. Judgment from people on that. Like, it was really hard to navigate because I'm like, you don't like, I think it just shows that like there's such a different world we live in a certain sense. Not that we live in a different world in an isolated sense, but like the things we have to consider on a daily basis are so different. And I think it's sometimes that reminder that like, you know, that might not be something that they have to consider, but it can kind of just be it just lead to some feelings that require processing. So,
Shannon, it's interesting because I think if it was a movie, they would romanticize it.
mhm.
But when it's not a movie, they're looking at you like, well, what is wrong with you?
Yeah,
And that gets me every time. It's not okay. Do better.
yeah, do better. I sometimes I just want to put in a shirt, be like, don't stare, it's just a feeding tube. Like, you know what I mean? Or like, don't stare, it's just, psoriasis. Like, I just want to like just tell the world, but alas.
Oh,
Yeah,
that's funny. Sarah said that. Romantic. Sorry.
no,
I
you're
was gonna
totally.
say, Oh, sorry, Sarah. It's up to you go.
Oh, I was just gonna say, like, people don't understand the whole picture. That's what we hope to bring to light with having these discussions. It's like you can look at someone from the outside and judge them and think that you kind of know what's going on in their world, but you don't. Like, you don't know, and no one knows anything about each other just by looking at them. That's kind of the whole point. It's like someone could be going through a big loss in their life or financial issues or physical health issues, and you have no way of knowing just by looking at someone, which is why we always say just be kind to other people. Like, you don't know what someone's going through. It could be literally anything. And it takes just as much effort as it does to be kind as to be mean or judgmental. Like put that energy into something good and, pass it on, move it forward.
Mhm.
Sorry, Morgan, you were going to say something too.
Oh, no, no. I was just gonna kind of bounce off of what Shannon had said about I feel like people can easily look at some of these conditions and yeah, the romanticized conversation about like, oh, they see what it might present as or like the pretty sides of it, but and that's what they're like, oh, that's great, that's great. Because I actually have gastroparesis myself too. And I've been told multiple times by people like, oh my gosh, like I wish I had a condition where I couldn't eat. And it's like, no, you don't actually.
Yeah. Well,
And sorry.
oh no, go ahead.
Oh, no, I was just say no. It's like because they again romanticize like oh the one benefit of it, but if you know the reality of the condition, then you would. That's when it's suddenly gross, disgusting. You want nothing to do with it,
Mhm.
and you have to learn that it's a whole thing, the whole package. You just don't get one part that you want to pick out from it.
Oh
Uh,
yeah, it's like, wait, you don't get to like, check out of it on Thanksgiving? No. Nope. This is a this is a constant thing. Yes, you're so lucky you don't have to work. That's another thing too that I know like is such a common sentiment, I guess.
yeah,
Also,
then they don't
stability is
understand.
not enough to live on if you are granted it. Like it's a benefit. It's like, is it? Is it really a benefit? Would I? There's multiple sides to the coin. Um,
Yeah,
but
definitely. And then Stephanie, sorry, I just want to double check. You had just asked the treatment question, was that right? Or
no, but I think we touched on it a little bit.
okay.
I did the how's your life change day to day, but that kind of goes in hand with treatments a little bit. Do
Okay,
you guys
sorry.
have anything
I
else
had to
you
cut
want to
out when
say
you
it?
said it. I just wanted to
No.
make sure I wasn't repeating the same one. So, I would love to hear from both of you all about, and I know you've already touched on it as well, but some of the most, or what would be the most impactful experience you've had regarding one of your conditions, whether that's good or bad. And I know Shannon, you talked about with that one doctor, but maybe that's the situation, or maybe there's another example. I know Jen, you talked about when they gave you that diagnosis. Um, I guess if you all wouldn't mind sharing on that.
I think for the good part, I would say it's made me the person who I am today. I think by far I'm more compassionate than I think I would have been. And I will never want that taken away from me. I mean, granted, I don't want to live with the health I have, but I'm so grateful for the person it's made me to be and the people that I've been able to meet. I've been able to go to events and hear from rheumatologists and researchers about up and coming treatments that they're working on and it gets us excited because we can't wait to find out if there's going to be something that pretty much has everyone in medical remission. I mean, I know that there are some medications that do, but to know that that can happen, or even when a follower reaches out and says, hey, this is what's going on with my skin or my joints. Do you have something that you recommend? And then you do, and you hear back from them. They're like, oh my gosh, this worked. Thank you so much. I mean, those are the moments I live for. I want to make everyone else's lives easier. So if I can put myself out there and share the good, the bad, the ugly, just to make your life easier, I'm going to do it. I might look like a crazy person, but I'm all right doing it.
No, that's so important. And thank you, Jen, for being open and vulnerable and able to do that. That's kind of why we started the nonprofit as a whole, is like to bring people together to share these things and to hopefully educate others, not only for those who don't have chronic illness, but just to kind of open their viewpoint to it and what people deal with, but then also helping people who have these illnesses too, being like, or someone who's undiagnosed going through this process being like, I don't know what's wrong with me. My doctors don't either. And I'm just trying to get all the information I can and giving people a direction to look into. And we've heard back from some people and they have gotten diagnosed because of some things that we've shared. And that's the best feeling in the world. It's like it shortens someone's time of getting help. And that's, like you said, it's like we live for that every day. And thank you for sharing that.
Yeah, and I'll go one more thing with that. It absolutely is. And people call me the people collector. And that's because I like to meet people and find out what's going on with them. I want to know what is your condition? What have you tried? can I connect people to other people that might give them the answer? And that's why I started the podcast that I run, because I want to see how I can help other people, whether it be, my condition or someone else's. So if I know someone that can help Shannon, I'm going to connect that person to Shannon and vice versa, and, all the things. So, sorry.
No, that's great. All great stuff. I would say, there's the good, the bad, and the ugly. As you said, there's all of the things, and I think it's hard to even just pinpoint it to one or two experiences. But I would say, like the experiences I've had, both good and bad, have really shaped my passion. Like I am like healthcare policy excites me. People look at me and they're like, don't get me talking. Like we could get going, like, but like that excites me. And like patient care, like improving patient outcomes, like giving rare diseases a voice, giving patients a voice. Like, how can we improve patient care? How can we like, not to get super like nerdy into it, but like we spend so much on healthcare as a nation, but yet so many of us left diagnosis list, gaslit, feeling like the system has failed us, our insurance companies fail us. Like, how can we improve? Because this is about the people. This is about the people who go to bed at night fearing what it's going to be like when they wake up the next morning. And I would say, like, if I hadn't been in that boat, like, that passion both on the policy side, but also in the patient care and being the one, like, knowing that, like, slamming Benadryl is going to make you feel like a little like wacky, like knowing even those little things of like pushing it slower, knowing like if a patient's nauseous, like, oh, here's an alcohol swab, maybe that'll help. Like those little things, like I feel like make such a difference. But I would say if I hadn't had the experiences I've had, both good and bad, I wouldn't know the change I want to see and the things I want to prevent. And I think like I can say confidently without a doubt, I don't know what my career like. I feel like I have found my passion and the thing that excites me because of my personal experiences. And that's just something I feel so grateful for, And like I know there's some people that are like, I don't know what I want to do with my life. And for me, like, I don't know where I'll end up, but I know where my passions lie. And that is, I think, worth $1 million.
I think you both are so amazing, by the way, for turning these conditions, which have taken so much from you on paper, right? And turning them into these really life-changing journeys and saying, hey, I'm gonna make something out of this. I'm gonna help other people. I'm gonna use this as my passion and as the reason I wake up in the morning to keep going. So like you guys are absolutely awesome, and it's such an honor to like hear you both talk and hear about what you've done with your lives and w will continue to do and plan. So just wanted to say that real quick.
Yeah, thank you guys so much both for sharing. It's there's a lot of work that needs to be done, but it's like everyone can chip away at it and impact people who then impact more people, and the chain just keeps going on. And you guys are starting that domino chain, and that's an amazing thing.
I just feel
Jen,
honored to be, I feel honored to be surrounded by such amazing people. I think this is like one of those things that, like you said, everyone does their part, but I think having a space where you feel like seen and heard in these niche challenges, I think it is just absolutely priceless.
I agree. It's important.
yeah. I know we've kind of touched on this already in some way, shape, or form, but what challenges have you guys faced within the healthcare system, within an education system or workplaces, any kind of institution-based organization? And things you might want to talk about include like, what have your experiences been with schools, your workplace, healthcare systems? Have you experienced stigma, discrimination, medical gaslighting, any accessibility issues, things like that? And how has that impacted you?
I think one of the big ones for me was insurance not wanting to cover my meds. And they don't always tell you about the copay programs, which if anyone's listening, well, I guess you are listening, but know about the copay programs. Look into them. Most manufacturers have them. It's worth it. A lot of times I've been able to get my meds down to, $5 or something. But especially if you're on infusions, not only are you paying for the medicine, but you're paying a copay for the infusion room itself, for the IV fluids and all of that. And so that's kind of where mine was, is just not finding out that they were very, very expensive. And the frustration I have for my friends that are trying to get one covered that is covered for me, and I'm being wishful I could just give it to them. It's frustrating. And we all run into it from time to time, even with my mother-in-law for her diabetic medication, going with her and they're like, okay, $500 for this one med. Are you insane? I know. I just that is my biggest issue and my biggest beef. As far as that, for other things, I'm not really sure I've dealt with much. There's been times where I'm having a harder time and I've had to be at the front of the line to get on a plane. People look at me a little odd, but oh well, you don't know what's going on with me. You don't I might look what you think is normal, but that doesn't mean that I'm going to have an easy time getting on the plane. So maybe I'd like to go ahead of you. Sorry. But I don't think I've ever had anyone actually come up to me in public and have a problem with me. So I feel very thankful for that.
I feel like I can speak to the education system. I'm very, very blessed. The university I'm at now has a wonderful disability services coordinator. Actually, I hosted an RI program the other day, and she came and stopped and chatted for like 20 minutes. She's amazing. I had an issue with a professor last year who was very much invading my privacy, in
Mm.
terms of my health. And it was really tricky to navigate because things were being said about me, and it ended up being a whole fiasco. And people are like, where's the problem? Like, I don't see, like, why is this even a thing? And I'm like, that's a great question. So I felt like I was really blessed to have people to help me advocate. The people on campus who I had to meet with were like, yeah, like this isn't okay. And I don't think it was intentional on his part. I just think it was a communication the delay, a communication delivery issue, and kind of but I think in the education system, I'm so grateful for my university. The accommodations I've had, the professors I've had have all been amazing. But I think in my high school, it wasn't so. I was at a private high school from seventh grade to 11th grade and left my senior year, which ironically was 2020. So it was a short year because of COVID. And I left the school because I was being discriminated against. I was being told I could not have accommodations while the person sitting next to me went downstairs and got the testing room. I was told she had to take her exam in the testing room. I had to take the same chemistry exam in the back of the classroom while an explosion experiment was going on. And I was told they couldn't meet my needs. And I said, that's a lie. I'm watching this girl who I know has at least one similar condition to me. I don't know her whole story and I don't claim to. And you tell me it's not possible. And the response I got was, I'm not. And my mom even helped advocate too. She worked in higher ed at the time. And she said, like, this isn't right. And like, we're not at liberty to discuss other people's medical care. And I just said, like, this isn't okay. Like, I had a teacher actually one time, I was a junior, and I had to go during my lunch hour to take my exams. I had to go stay after school to finish my exams because of my extra time. And one morning I went in and I said, hi, like I'm here to like finish my exam. And all the cool kids, whatever that meant, all the cool kids were in her classroom in the morning. And she yelled at me in front of everyone. Who do you think you are trying to get extra time and come look at the test again? It's like, that's my accommodation. We've only been doing this like 8 months now. She's like, well, I don't know if other teachers are letting you do that, but that's not right. And that is not happening. So I walked out crying and I went down to my guidance counselor. I'm like, I'm not, like, this isn't okay. And I was given a pat on the back and told I'm doing great. I was later given an apology saying, oops, I didn't realize it was you. And like, okay, but like, again, like you said, treat people with kindness. That's when you pull the student aside and don't yell at them in front of your own kids who happen to be student. Like, and it was mortifying and like it was dehumanizing. So I think for me, like one of the biggest challenges, and I'm so grateful as I've grown, I feel like I'm much more supported in college. But like I just think that boundary of like, hey, treat us with kindness, like we are not any less. We are not. I feel like there can be a stigma like, oh, people with accommodations don't have to work as hard. Actually, no, we have to work twice as hard, and these help us like not pass out during an exam or whatever. So I don't know, and I'm thankful that my mom happened to work. She was a professor at the time, so she was able to like knock some sense into them. But I ended up leaving the school because I'm like, guys, like I can't make you care. And I had a phenomenal experience leaving the school. So I suppose even knowing when to let go and to know that you can't change a system and not let that be about you. I had to say like, hey, this isn't fair. This is unjust, but like I can't change the system. There are too many wealthy donors to the school that care more and they care more about them than me. So I'm gonna go and like do what's best for me and I'm gonna own that. And I think that's empowering to say that like this system is not right, but that's not like not letting that be a reflection of you, if that makes sense. So I don't know. That's kind of long-winded, but hope that makes sense.
No, that 100% makes sense. And I'm, again, so sorry that you had to go through that experience. That's not right at all, like you said. And it's you do have to do what's best for you. And I'm glad that you had that strength in you to do that. And I just there's no words, honestly, for stuff like that. It's not right.
And like my fear is like people who don't know how to advocate. People
Yeah,
who don't know their rights. How many people in our community feel silenced and live their lives in feeling ashamed of something that makes them unique, because of the way that they are treated in academic settings where there is so much competition.
100%. And like you mentioned with accommodations, it's like this isn't accommodations are not an unfair advantage for people. It's like it's something to level the playing field and to make you meet where the average normal person is at. It's yeah, if an average normal person had accommodations like what you had, yeah, that would be unfair. But that's not the case at all. Like it's bringing everyone to a similar level so they're able to function and do the same things. And I'm so sorry you had that experience. Again, same with you, John. It's an unfortunate reality of dealing with invisible and chronic conditions. It's just there's so many invisible struggles that people don't realize happen until you kind of go through it yourself, unfortunately. And it's important why we keep talking about them and bringing them to light so people can kind of understand. And so eventually systems can change. We can have enough people forming change in those types of situations. Um, we're kind of coming close to 8 o'clock already, and it's wild how we've gone through almost an hour of stuff already. But if we could kind of wrap up a little bit, what advice would you give to someone who's newly diagnosed or suspected of having a condition, or just in a couple sentences, what would you tell them?
I would say don't give up. There's somebody out there that can be a support system to you. And there's a lot of people like myself, and we're willing to talk to you and give you advice and just listen and walk alongside you as you deal with this because nobody needs to navigate it alone.
Yeah, I love that. I would say find your people. Find the people who cheer you on, embrace those people, and the people who don't cheer you on, like, don't let that break who you are and to never lose hope because you never know who you are inspiring and you will look back on those hard days and be so glad you didn't give up.
And those people aren't for you.
Mhm.
Wow, amazing. I absolutely love, love, love what you guys had to say there. Yes, having your own identity and knowing who the people are for you and what you can do, keep persevering, keep making change, and both of you exemplify that so well. So it was so lovely hearing from both of you tonight.
Thank you.
Alrighty, I think we're gonna go ahead and transition into our ending here. Alrighty. So yes, please, please, please go follow our guest speakers again. I read them off at the beginning, so I know we're getting short on time. So go back in the tape if you're watching the recording and follow them there. But again, thank you, Jen, and thank you so much, Shannon, for speaking. And then if anyone has any questions as well, if they want to put them in the chat, that would be great. But in the meantime, we'll go ahead and go through our announcements. So you can watch our previous guest speaker events on our YouTube channel. And we're always looking for new volunteers and people interested in being guest speakers. So if you know anyone that you think would be a wonderful fit to come speak here at IIIN, that would be wonderful. And if you yourself are interested, you can email us as well. Our email is info@iianetwork.org. You can also follow us on Instagram to see when we announce our October event. In October, we will be covering dysautonomia. Alrighty, and again, here are our end credits. So please follow us on social media and our website. You can get the links for all of those at our link tree. And thank you so much again for everyone coming and listening to our amazing guest speakers tonight. We hope to see you next month. Alrighty. And if there's no questions in the chat, I guess we'll go ahead and end the meeting. Thank you all.
Thank you.
Yeah, thank you again for your time tonight. We really appreciate you sharing your experiences and being vulnerable with us.
Been an honor. Also, one little plug I want to put in there that I wasn't organized enough to put in there. I do run a Facebook support group with a dear friend of mine for patients with abdominal vascular compression syndromes, diagnosed, undiagnosed, unsure where they fit. So it's called Teens and Young Adults with Abdominal Vascular Compression Syndromes. I know that's a mouthful. If you send me a message on Instagram, I can send you the link, get you connected. Something really passionate about. So just another little plug that I forgot.
Awesome. Thank you for sharing.
Thank you guys so much. And thank you, Jen. I really, and Morgan and stuff, like, thank you. Like, it's just been lovely to learn from you all.
You. It was great to meet all of you.